name is Eddie Reyes. Today we're going to do cervical stretches, and we're also going to do lumbar stretches as well, okay? Whenever we do cervical stretches, the first thing we want to do is warm up the tissue, which tissue meaning muscle. Special, okay? And typically we do this maybe about a minute or so. Okay. After we warm up the muscle fibers in the neck, we're going to start doing the cervical stretches. When we do the cervical stretches, we're going to go different planes of the muscle. When I mean different planes is we're going to stretch the muscle in different ways to make sure we hit all the different muscles in the neck as well. Okay. So, okay, we're going to go to each side about 3 times. Sometimes we ask the patient to please help us a little bit, and when they get to the end, we give them a little extra stretch, and it helps extend the stretch a little bit farther as well. Okay. 2 minutes. So far, everything's good? Mm-hmm. Okay, so now we went side to side. The next stretch we're going to do is we're going to go up and down here. And this helps stretch out the lower part of her neck towards the back. Okay, now we're going to start stretching towards the angles. And then we do the other angle. Okay, and then we're going to go all the way down, all the way to the side like this, and then come up. Please make sure when you do this stretch here, it's not too forceful, because if they have any previous injuries, if you go too forceful, it can cause damage on the vertebrae. Okay. And that's the different planes of the stretches we're going to do today. And the next thing we do after we do the stretches, we do some light traction. And the way you do this is we put our base of our hand, we're going to put it on the back of her head, which is right here. And we're going to pull, you want to have whatever hand you're stronger with, you're going to have that on the base of the patient's head. And then with the other hand, you're going to just put it over their forehead, not too tight of course, and you're going to gently just pull back. Okay. By gently pulling back, what we're doing here is that we're separating, if there's any impingement, if there's any pinching of the nerves in the area, we're help separating pressure from that, hence the pain can go away, especially if it's causing a lot of stress. And that's how that's what we do to do cervical stretches. Our next thing is we're going to do lumbar stretches. We're going to use the same philosophy as when we did cervical stretches, as we're going to be stretching in different angles as well. Just tell me how the pressure is looking. So I went lateral first, which was this one here. Then I'm going more towards the chest this way, and then I'm going to go towards the opposite side. So I'm going to put my elbow right here and hold the patient's leg, and then go in like this. Okay. And then I'm going to stretch the hamstrings. Okay. Another thing that you can do also at your home, if you don't have somebody that's giving you a massage, you can make almost like if you're doing a 4 and go like this, and then you have the patient grab with one hand here and the opposite hand grab in between and pull this leg back, or better yet, let's do it on this side. You put this leg here and in between there, and then pull this leg back, and see, this helps stretch out the gluteal muscle, and you can do that by yourself as well. So because she'll be pulling herself, and it gives a stretch as well. Okay. And then we'll do the other side. Okay. Whatever we do on one side, we want to make sure we do it to the other side as well. You're going to do the stretch like this, just like that. You go forward. Okay. And then we finish the stretches with both legs. We come forward like this. We want to make sure our knee is on the table, because if not, there's going to be a lot of weight pushing towards the end of the table, and you don't want the table to fall down. With your strong leading arm, you push the legs, and with the other hand, you just kind of gently curl up. And this helps stretch out a lot of the lower back as well, and a lot of the gluteal muscles. And then the next stretch we're going to do is for the psoas stretches. The reason why we're going to do the psoas stretches, because sometimes when you have lower back pain, that means your quadriceps are too tight, and it's putting too much pressure on your mid area here. And if your quadriceps are too tight, it tends to make your body lean forward like this, but nobody walks around bent over. So your body, it automatically corrects itself, and you go forward, or you go back. So, and then it creates a lot of tension on your lower back to help overpower the strength of your quadriceps and your psoas muscle. So whenever we do lower back stretches, we want to include the psoas stretch as well, and I'll show you how to do that. Okay. This one here is the patient's going to get in a lunge position. Okay, and just relax, because we're going to be lifting up this leg, so they're going to put a lot of weight on their on the table. We're going to grab the leg. First, we're going to flex the quadriceps a little bit. We're going to put our strong hand under the knee, and then go up. And go down. Okay, and we're going to do the same thing on the other side. Okay, and we are all done. And that's how we do lumbar. That's how we do cervical and lumbar stretches. Thank you.